Hi vlog. What time is it now? It's 4:30 a.m. Um anyway, this is Janet and the Kosh TV channel backed by a group of experts. That's the Kente of Experts Club International. Main aim is to improve the well-being of the individual, family, and the community as a whole. And I believe we, the health experts, are also part of the community. Yeah. If we render services, we should also be looked after if we are feeling under the weather. I've ever lived in a country where health experts are giving some sort of priority when it comes to. I've lived in a country where health experts are kind of giving priority when it comes to their well-being when they are ill. And you present yourself to a health facility or a hospital, and they happen to find out that you are a nurse, a doctor, anyone who's, sort of like that. You are taken good care of, because to believe you need to get better and then get back to your patients. So anyway, I'm not sure what is going on, but there is a problem with my documentation, and I'm not being informed reliably. I would say it all started with my ex-husband. He's a mental health nurse. So it's kind of hindering the progress of my assessment and treatments. I've suffered musculoskeletal issue, which is still ongoing. I've been suffering headaches. Medication prescribed hasn't really worked. Recently, I've noticed that my blood pressure has been going up. I wouldn't say I am under stress. I wouldn't say I am so much under stress. Yes, the stresses that are coming my way, I would say, are every day kind of stress. Well, recently I've had another unexpected turn of events in my life, which I'm kind of dealing with. If you saw my previous vlog about my surgery being put on hold, I was asked to see a team or a group of people. Honestly, I was asked to come for physical assessment. Yes, I had my blood taken, my blood pressure taken. I wasn't really in the mood of talking about the past, but it looks like the nurse was more interested in listening to my past than anything, because I was there for health assessment, and I was made aware that the GP was going to be contacted so that the necessary assessments are done for a proper diagnosis before the surgery can go ahead. But it looks like the nurse was more interested in listening to my story from the past. I I had my blood pressure taken for the very first time. It was really high, 149/99. The very first time high. Usually my blood pressures are within 120. Diastolic, the highest diastolic I've clocked, I think it's about 80, which was something I actually was worried about. And to me, being a nurse, this should tell someone that it's either due to some form of discomfort somewhere. I mean, there are so many areas that investigations can take, and if obvious, then the patient obviously is complaining of a discomfort, what do you do? This assessment actually was done on a Friday. Today is the 4th of March 2026. I saw the nurse on a Friday, 27th. Actually, the team actually said were coming to see me on the 10th of March, but for some reason I've had a call again. I didn't say. I was wondering what was going on. I don't know if it's a miscommunication from them or if they want to see me multiple times. I do not know. I was there. I received a text message to come in on 27th for an assessment. I was given a time. Was in bed. I had another call which said if I could come in earlier. Well, reluctantly, I went in. So if you've seen something like the blood pressure gone this up and it's not happened before, okay, what do you do? Do you proceed to do a further assessment? I do not want to seem to be coming across as if I'm putting the pressure on, but to me, this is what should be done. What I think is a cause of this raising blood pressure is due to headache. The headache I've been suffering, which has been well documented over time. Yes, I've had a stress in my life recently, and that may have also contributed to the raise in blood pressure. I'm just wondering, take a walk to my surgery. Sometimes you take the walk there to talk to someone, and you're made to feel as if you are being a bother. They will tell you to go online and then fill a clinical form. And the clinical form, it depends if they actually want to see you or not. Sometimes you fill in, they tell you they can't see you because they are so busy, because it's been done to me more than twice. So I actually do not want to be using this channel to be talking about personal stuff, but I'm kind of being forced to do so. It looks like the system likes this way of revealing, talking things about yourself. It looks like there is no more confidentiality when it comes to your health. There's nothing like they want you to put it out there, and if there is someone behind this, I hope you're happy doing this. Okay, I hope you're happy doing this. No one really wants their life to be put out there. No, not even the A-lister celebrity out there. They do not want their life, their health records put out there. But if someone intentionally has done it in the past and is trying to cover up by forcing me to go through this medium, if I find out, I'll seek a redress. I will seek a redress. I will. So I'm still waiting to hear from them regarding, probably they're waiting for blood results, but the blood result takes 24 to 48 hours. The results should be out. I know I'm not going to say much about it because it will be kind of revealing so much about myself. I'm managing my headaches with paracetamol, cocodamol. Yeah, I'm managing as much as I can. I think I need a neurological assessment. That's what should be done. But hey, we leave it to the experts. They know best. At the moment, I am at their mercy. So, nurses, doctors, anyone who works in the healthcare system, healthcare industry, look after yourself and look after your patients. When it comes to your patient, put yourself in their shoes. The way you are treating them, would you like to be treated the same way? That's where you find your answer. Thank you. Remember, you and your community are responsible for your well-being. So make it a point to be a positive impact or influence wherever you are. It's like I'm your way again, I say. Keep healthy and bye-bye.